Welcome to Leaders' Questions.
This winter has set yet more alarming new records for people on trolleys in our emergency departments. And that means more people whose care may be compromised because there's no space for them or no one to admit them. It means more risks for patients' conditions to worsen in a place where they should expect to improve. Taoiseach, I welcome the new efforts by the Minister for Health announced to tackle overcrowding, and these are long overdue. In yesterday's press release from her department, she identified two issues exacerbating the problem. The first, she said, is the ongoing lack of capacity in hospitals, and the second, she tells us, is the increased numbers of people on trolleys over weekends and on bank holidays due to lower discharge rates. And she spoke strongly on the radio about this earlier today. Now, these are serious issues, but Taoiseach, the single largest problem in reality is the continued chronic shortage of healthcare staff, of nursing staff, of support staff, of medical staff. The continued pause on recruitment is having a real and serious impact on healthcare in our communities and our hospitals. And everyone knows this. Anyone who's recently visited a hospital knows this. So it's not just our view in the Labour Party. Last week, the Irish Nurses and Midwives Organisation released their first Behind the Trolley Numbers survey, conducted by nurses working in acute hospitals, treating patients on trolleys and hospital corridors, the real-world experience of those on the coalface of the crisis. And their view is overwhelming. When it comes to ending overcrowding, 83% identified bed capacity and 80% said recruiting more staff was key to addressing the issue. So, Taoiseach, when it comes to building hospital capacity, clearly there are a great many measures that must be taken. And some of these have been announced, in fairness, by the Minister. And we would welcome these. Measures like digitising health records, long overdue. New methods to increase productivity. Forward planning in advance of weekends that we know will place more strain on the system. But, Taoiseach, ultimately, these measures will come to nothing until your government acts to recruit more healthcare workers and until you introduce ways to improve conditions for staff who are already there so that we have better retention rates, because staff do not feel they're being treated with respect. We have an ageing population, we have more complex needs than before, and demand for emergency care has increased. But that's no excuse for outrageous gaps and delays in the system. Last week I raised the case of an elderly woman in my constituency left waiting 3 hours for an ambulance to take her 10 minutes up the road to a hospital. And I've received contact from so many other paramedics and ambulance workers since then about the care they provide being compromised by staff shortages. So, Taoiseach, when will we hear more about the new healthcare plan, specifically on staffing and working conditions? And crucially, when will your government act to carry out the necessary recruitment drive to ensure that we have enough staff working in our healthcare system?
Thank you, Deputy Taoiseach.
Well, I do spot out of Bhín go bhfuil brú na seirfisí ag an dála agus go háir na hospidéal agus bhí sé sin le feiscint de a seachtainna níomh bríd. Níl sé sásúil agus tá sé sin ráite ag an áras sláinte. Just want to say at the outset, I acknowledge first of all the very significant challenges facing emergency departments, particularly over St. Bridget's weekend, and the pressure on people and the distress that causes to people waiting long hours in our emergency departments. But I do think that the overcrowding at St. Bridget's bank holiday weekend, and I think the Minister is right to highlight this, was directly linked to low weekend discharges and subsequent high numbers on trolleys. Now, this has been an issue for quite some time. The introduction of the public contract only and that's a very significant development that was achieved last year. But that was very much linked to a changing roster arrangement and deployment of senior decision makers in our hospitals to give weekend coverage. I mean, historically in the Irish Public Health Service, weekends are the worst time to be admitted to a hospital. So the House needs to engage with that. There has been enormous investment in health in the last 5 years, by any standard, both in recruitment and also in terms of infrastructure. And there needs to be more. We also need, parallel with that investment, to analyse forensically the deployment of people with a view to getting the optimal outcome for patients and for people who attend our hospitals. We have wonderful people working in our hospitals, but we've long said it can't be a 5-day, it has to be rostering of senior decision makers to enable better discharge. And that we don't get this weekend, particularly bank holiday weekends, which has been a feature. Now, there's been some successes on that front. Some hospitals, like Waterford, Tullamore and Connolly, for example, had 0 or low trolley numbers as well. So there is a management issue as well of resources, and we need an increase in resources. And we've been recruiting extensively, and funding has been allocated for further recruitment of staff this year, particularly medical staff, nursing, allied healthcare professionals in particular. And I think these are issues we need to discuss and engage with hospital managements and with representative bodies as well. Not just on its own increases. We do have to analyse deployment and make sure we get the best outcomes for patients. And I think that's what the Minister has been highlighting in her comments and in the data she's received back, particularly in relation to St. Bridget's weekend.
I've acknowledged there are issues, clearly, with discharge rates at weekends, and clearly there are issues with workflow and management practices. But changes in workflow and management practices are no substitute for properly addressing the real issue here underlying the crisis in healthcare, and that is the issue of staff shortages. We're hearing from hospitals that know they need to recruit more staff, have identified gaps, have engaged in recruitment, but are not getting the go-ahead from the HSE to be able to offer the jobs. And so we hear from healthcare workers who are leaving for other countries because they are so chronically overworked due to staff shortages. And this is not just in emergency care. This is across our healthcare system. The shortage of public health nurses in the community is causing babies to miss key developmental checks, and the HSE has confirmed that it has had to scale back its service, therefore leaving children and babies at the mercy of a postcode lottery in terms of key developmental checks. So I'll ask you again, Taoiseach, when will you carry out the necessary recruitment drive? When will you end the pause on healthcare recruitment so our communities can get the healthcare that we so badly need?
To respond.
Yeah, first of all, there's ongoing recruitment. I mean, 25,000, there are now 25,000 more people working in the health service since 2020. 25,000 more. And that's in terms of nursing, in terms of consultants. The number of consultants employed in our health service has gone up 42%. 42%. And we're continuing to recruit. And there is ongoing recruit, and funding was put into the estimates for additional numbers in 2025. And yes, the attendances are also going up. Ageing population isn't putting pressure on our emergency departments. What is working best is a whole of hospital approach to emergency departments. And where that is very evident, it's producing results in a number of hospitals. And there's been analysis of certain different hospitals in terms of what's been happening within them and so on like that. So recruitment is ongoing. We're committed to further recruitment of housing staff, as well as investment in capacity and in elective facilities like surgical hubs.
We now move to Deputy Cian O'Callaghan.
Like, share, and subscribe, and let us know your thoughts in the comments. We'd love to hear from you.